Would you like free audiobooks? Click the link in the description. Question 1. The patient exhibited signs of acute distress. What does acute mean in this context? A. Chronic. B. Mild. C. Severe. D. Gradual. Answer: C. Severe. Rationale: in medical terminology, acute refers to conditions that are severe and sudden in onset. It contrasts with chronic, which describes a condition that develops slowly and lasts for a long period of time. Question 2. The nurse noted that the medication had a benign effect on the patient. What does benign mean? A. Harmful. B. Gentle. C. Dangerous. D. Painful. Answer: B. Gentle. Rationale: benign refers to something that is not harmful in effect. In medical contexts, it is often used to describe conditions or growths that are not malignant or harmful. Question 3. The doctor emphasized the need to adhere to the prescribed treatment. What does adhere mean? A. Ignore. B. Stick to. C. Change. D. Disregard. Answer: B. Stick to. Rationale: adhere means to stick firmly to a plan or procedure. In this context, it implies following the prescribed treatment consistently and accurately. Question 4. The patient's symptoms were alleviated after taking the medication. What does alleviated mean? A. Worsened. B. Relieved. C. Ignored. D. Compounded. Answer: B. Relieved. Rationale: alleviated means to make something less severe. In medical terms, it often refers to reducing the intensity of symptoms. Question 5. The prognosis for recovery is favorable. What does prognosis mean? A. Diagnosis. B. Treatment plan. C. Likely outcome. D. Symptom. Answer: C. Likely outcome. Rationale: prognosis refers to the likely course or outcome of a disease or condition. It is a forecast of the patient's chances of recovery. Question 6. The medication should be administered intravenously. What does intravenously mean? A. Orally. B. Through the skin. C. By injection into a vein. D. Through the nose. Answer: C. By injection into a vein. Rationale: intravenously means administering a substance directly into a vein, typically via an injection or in 4-line. Question 7. The patient was lethargic after surgery. What does lethargic mean? A. Energetic. B. Indifferent. C. Drowsy. D. Anxious. Answer: C. Drowsy. Rationale: lethargic describes a state of sluggishness, inactivity, and lack of energy. In medical contexts, it can indicate a decreased level of consciousness. Question 8. The nurse monitored the patient for signs of dyspnea. What does dyspnea mean? A. Rapid heartbeat. B. Difficulty breathing. C. Nausea. D. Sweating. Answer: B. Difficulty breathing. Rationale: dyspnea is a medical term for difficulty or labored breathing. It is a common symptom in many respiratory and cardiac conditions. Question 9. The medication has a high efficacy rate. What does efficacy mean? A. Safety. B. Cost. C. Effectiveness. D. Side effects. Answer: C. Effectiveness. Rationale: efficacy refers to the ability to produce a desired or intended result. In medical terms, it measures how well a treatment works in clinical trials or practice. Question 10. The wound showed signs of necrosis. What does necrosis mean? A. Healing. B. Inflammation. C. Tissue death. D. Swelling. Answer: C. Tissue death. Rationale: necrosis refers to the death of body tissue, often due to injury, infection, or lack of blood supply. It is irreversible and can lead to serious complications. Question 11. The patient was advised to follow a low-sodium diet. What does sodium refer to? A. Sugar. B. Fat. C. Salt. D. Protein. Answer: C. Salt. Rationale: sodium is a chemical element commonly found in salt. In dietary terms, reducing sodium intake can help manage conditions like hypertension. Question 12. The infant's jaundice was closely monitored. What does jaundice mean? A. Fever. B. Yellowing of the skin. C. Rash. D. Swelling. Answer: B. Yellowing of the skin. Rationale: jaundice is a condition characterized by the yellowing of the skin and the whites of the eyes due to high bilirubin levels, often indicating liver problems. Question 13. The patient experienced a transient increase in blood pressure. What does transient mean? A. Permanent. B. Severe. C. Short-lived. D. Gradual. Answer: C. Short-lived. Rationale: transient means temporary or short-lived. In this context, it refers to a brief increase in blood pressure that is not sustained. Question 14. The patient's gait was unsteady. What does gait mean? A. Posture. B. Walk. C. Balance. D. Speech. Answer: B. Walk. Rationale: gait refers to a person's manner of walking. An unsteady gait can indicate problems with balance, coordination, or strength. Question 15. The treatment was deemed palliative rather than curative. What does palliative mean? A. Healing. B. Pain relieving. C. Preventive. D. Diagnostic. Answer: B. Pain relieving. Rationale: palliative care focuses on relieving symptoms and improving the quality of life for patients with serious illnesses, rather than trying to cure the disease. Question 16. The nurse noted edema in the patient's legs. What does edema mean? A. Redness. B. Swelling. C. Bruising. D. Itching. Answer: B. Swelling. Rationale: edema refers to swelling caused by excess fluid trapped in the body's tissues. It often occurs in the legs, ankles, and feet. Question 17. The patient was prescribed an analgesic for pain. What does analgesic mean? A. Antibiotic. B. Pain reliever. C. Anti-inflammatory. D. Antidepressant. Answer: B. Pain reliever. Rationale: analgesic refers to a class of drugs used to relieve pain. Common examples include acetaminophen and ibuprofen. Question 18. The infection was localized to the patient's arm. What does localized mean? A. Spread throughout the body. B. Restricted to one area. C. Mild. D. Severe. Answer. B. Restricted to one area. Rationale: localized means confined to a specific part of the body. In this case, the infection is limited to the patient's arm. Question 19. The patient was asymptomatic during the checkup. What does asymptomatic mean? A. Showing symptoms. B. Without symptoms. C. In pain. D. Feverish. Answer. B. Without symptoms. Rationale: asymptomatic means not showing any symptoms of disease. An asymptomatic individual might still have a condition or infection, but it is not evident through symptoms. Question 20. The medication had a potent effect on the patient's symptoms. What does potent mean? A. Weak. B. Delayed. C. Strong. D. Gradual. Answer. C. Strong. Rationale: potent refers to something that has a strong or powerful effect. In this context, the medication is highly effective in alleviating symptoms. Question 21. The patient's condition was described as deteriorating. What does deteriorating mean? A. Improving. B. Stable. C. Worsening. D. Unchanged. Answer. C. Worsening. Rationale: deteriorating means getting worse. In medical terms, it indicates a decline in a patient's health or condition. Question 22. The patient exhibited signs of hematuria. What does hematuria mean? A. Blood in the urine. B. Frequent urination. C. Painful urination. D. Inability to urinate. Answer. A. Blood in the urine. Rationale: hematuria is the presence of blood in the urine, which can indicate various underlying conditions, such as infections or kidney stones. Question 23. The procedure required informed consent. What does informed consent mean? A. Unconditional agreement. B. Agreement after full disclosure. C. Verbal agreement. D. Immediate agreement. Answer. B. Agreement after full disclosure. Rationale: informed consent means that a patient agrees to a procedure after being fully informed of the risks, benefits, and alternatives. It is a fundamental ethical and legal requirement in healthcare. Question 24. The patient was advised to avoid strenuous activity. What does strenuous mean? A. Mild. B. Gentle. C. Vigorous. D. Relaxing. Answer. C. Vigorous. Rationale: strenuous refers to activities that require a lot of energy and effort. In this context, it suggests avoiding activities that are physically demanding. Question 25. The nurse noted that the patient had a low hemoglobin level. What does hemoglobin refer to? A. White blood cells. B. Platelets. C. Red blood cells. D. Plasma. Answer. C. Red blood cells. Rationale: hemoglobin is a protein in red blood cells that carries oxygen throughout the body. A low hemoglobin level can indicate anemia or other medical conditions. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.